I do a subspecialty of OBGYN called maternal fetal medicine. I specialize in taking care of kind of high risk moms and high risk babies during pregnancy. The United States, just as a whole, has one of the highest maternal mortality rates of all developed countries in the world, which is striking. But then, if you kind of dig deeper, you see that if you select for Black women alone, that rate is up to 3 times as high as it is for non-minority women in the United States. It's hard to engage with a system if you think that they don't have your best interest in mind. This is potentially discouraging women from seeking care that they need. If they're concerned about, kind of systemic effects that they may take on because of the way they look, that might discourage them from seeking care, which might even further put them at potential harm. I would say know your risks. So that comes with kind of self-education. But beyond that, part of knowing your risk is, being able to see your provider. As maternal fetal medicine doctors, we do a lot of preconception counseling for women that may have high risk conditions. And before pregnancy happens, we sit down and we talk about, the risks that may come up during a pregnancy. There may be some adjustments that, a woman can make in medication, lifestyle, dietary changes that can boost her chances of having a positive outcome with the pregnancy. Doulas, especially, often come from a background and a perspective that allow much more like cultural sensitivity and awareness. And, I found them to be very helpful in sometimes bridging those gaps between providers and patients. If as a provider, you're just acutely focused in on just the science of saving someone's life, for example, it's nice to have a bigger team to help also with some of the other support. And unfortunately, a lot of these things that I'm mentioning, preconception counseling, routine prenatal care, being able to educate yourself, these are not things that are equally allocated in terms of resource availability for people. So that's the unfortunate piece. My framework in terms of perspective is, how can we be proactive so that we're not at a point where a patient has felt some type of implicit bias or some type of discrimination. So I think some of the proactive things to try and prevent getting to that stage is just listening. I think that's first and foremost what we all can always do a better job of, is just listening to patients. If they do come in with those experiences, listen to those experiences and, not be dismissive of them. I think it's hard because in any healthcare situation, there's always going to be that knowledge differential, just because, we're healthcare professionals. The more we as physicians can do to bridge those gaps, the better. We're all supposed to be educating our patients, teaching them about the processes that their bodies are undergoing. But I think on the flip side, I would encourage patients to be their own advocates in that realm. So asking follow-up questions or asking clarifying questions, or asking your provider to slow down in their explanations, especially if the patient feels like there are potential needs particular to them as an individual. If we're talking about, Black maternal mortality here in the United States, then that's an awareness piece that a patient could potentially just bring to the table and say, hey, I'm really worried about, my risk as a Black woman. What are things that we're going to do to try and mitigate some of those? It's like for me, if I'm taking my car to a mechanic or something, like my limited knowledge of, automobiles and just the issues with transmissions or engines, I think makes it hard for me to know what questions to even begin to ask. So I think it really ultimately falls on, the professionals and the providers. But, if I go into that encounter doing a little research, having some questions, it might bridge that gap a little bit, and it might lead me to having a better experience. And I think it's a group effort. We educate each other, but the goal is to, you know, acknowledge the facts and acknowledge the disparities, but still encourage women to kind of take that leap of faith. Certainly understand the worries and the concerns about the current healthcare system, but you know, there are great providers out there that are not only acknowledging these deficiencies, but working hard to try and fix them. And I think that there's plenty of us that are ready and willing to take up the challenge. So I don't want patients to be afraid to engage with the system.